Monitoring, as we just discussed, is how we are doing or what we are doing, we want to know. And evaluation is what have we done. We are assessing that what is it that we have done over the specific period of time in a project, in a program. And learning is a sum of both of those activities. What have we learned from my monitoring, or what have I learned from my evaluation, and how can I contribute that learning for future endeavors. So we'll also go through some basic concepts, just very briefly. You all work in this space here, so you know much better than me what is policy making or what government programs are. But just quickly going through the basic concepts. Policy making, in essence, are actions to reach a goal, similar to what we do in a program. The different processes by which, at a larger level, a government, or let's say an organization, or different institution may develop certain programs or projects to attain a specific goal. That in itself would be a very simplified essence of policy making. Couple of important facets in policy making that we need to keep in mind are, it is multidimensional. It can be across sectors. It can be across different levels. There can be a regional policy, a state policy, a national policy, or a global policy. It also involves different stakeholders because it has different areas. It will involve stakeholders from different departments. So one policy could have a person from a health department and a law department working together. And it can be in different forms. It can be a law, it can be a regulation, it can be a guideline. All of those constitute policy. When we talk about policy making cycle, there are a couple of steps that we generally, in theories, we focus on. It starts with the agenda setting, which is the formulation of your policy. Agenda setting essentially is deciding what is my problem areas. There would be multiple issues that exist in the society. So for a government, for a bureaucrat to decide and to start thinking about a policy, there are different aspects. It can be a prioritization of which is the most pressing problem that I need to address, or it can be the type of resources I have. So let's say a Bill and Melinda Gates Foundation is putting money in sanitation. It is bound to be that my program or my policy is going to be related to sanitation. So my priorities get shifted because of the resources that I have, because of the priorities that I have, or because of what a certain push I might be getting it. That my government is more pushing towards that, so that could be help develop how a policy is being formulated. That's my first step. Once a policy has been formulated, it is in the implementation stage. Implementation similar to what we do in a program, but being a policy, it can have a larger level or different forms of implementation. And once the implementation, we start evaluating policies. That what I intended to do in my policy, did I achieve that? Was I able to get to that goal, or was I halfway through? Where am I right now? So once I have this cycle, therein I can also envision where my monitoring, evaluation or learning could come in, and that's what we'll also look at later. Evaluation, oftentimes, we also see that sometimes policies terminate, but it rarely happens. It might, because policies by nature are something that are more broader and larger level, at times they get transformed or carried over into another forms or programs, and policies generally just continue that way. What Kezia also took you through a program cycle, which is how generally any programs, be it a government or a non-governmental programs, would be running across, is we have our problem or gap analysis, which is, I'm so sorry, it is very minute text, but I will be speaking. We just studied that problem or gap analysis is we are trying to identify what is the problem that exists, what are the gaps that exist in my situation, in my society, in my areas or geographies. Then I have my project identification and design. Once I have identified what is my problem, I go on to start thinking about how should I design my program or my project to solve that problem. Like we just discussed, what will be my activities? Once, also just keep in mind, as we discussed, situation analysis at times may happen along with your problem analysis or before your analysis, because it's a similar aspect that what is the existing situation. Situation analysis can be done at various stages. It can be before, at the time of identification of problem. It can also be afterwards. Once I have implemented my program, I may again want to know what is my situation like now that I have done everything that I wanted to do. So that's why it's in a circular format as well. So once I have identified my project, my design is set, that this is how I'm going to implement my program. These are the activities A, B, C that I have done. And I start implementation of the program. So let's say my problem right now is what we just took an example of, high dropouts. Children are not going to school. Simply building a school is not going to get children to school. There are multiple factors I need to consider. Issues can be the parents are not motivated. They don't have the money to send the children to school. Or the children themselves are not coming to school. The schools can be far off. So just building one school 30 kilometers away might not help. There are multiple issues that I need to address, and just one activity might not suffice. So once that multidimensionality exists in a program as well as in a policy, and this is what we tackle through the monitoring evaluations when we conduct that. Keep those factors in mind, that both programs and policies are multidimensional in nature. So once we have done our implementation, we start monitoring. We start looking at the progress we are making. The question that monitoring tries to answer is, what are we doing and how are we doing? If I'm doing what I intended to do, A, B, C set of activities, am I implementing all of those? And evaluation, be it at a baseline, be it at a midterm, or be it during the end line, it tries to assess what have we done. So in a midterm also, after 2 years down the line, it will try to tell you what have you done till now, what can you take actions now so that you can improve your functioning. Similar to what a monitoring also tells you. So there are these similarities also in your midterm evaluation and monitoring. Both are trying to tell you what activities can you improve, how can you take some course correction measures, and how evaluation in general at the end of it can then show whether a change happened in your results or not. Just the very basics of what you just covered of your program cycle. There are certain critical steps in a program design, which is like we just did in the cycle, identifying what is my problem or the challenge. How do I identify this? An exercise that is often done is called the needs assessment. So I understand what are the needs that my target population has. If I studied my dropouts, so I will try to assess that the high dropouts, what are the needs of the population that they are leading to this problem. After I have identified the needs, a needs assessment has been done, I start building my program goals and objectives and designing my programs. And once the program goals and objectives have been finalized, I start developing my strategy of how to reach those goals, which is my strategy is then getting divided or implemented through my activities. So strategy again is the broader term, activity is the more operational terms. And along with the strategies, obviously you have to consider your resources, because we are all working within constraints. There's a certain budget for each program, each policy that we get. So your program budget also dictates how your implementation happens, or for that matter, how a monitoring and evaluation can take place. And eventually, an important critical step in program design is also at the onset, try to identify your monitoring and evaluation plan. It helps when at the beginning we start putting in thoughts about what I want to monitor, how would I want to monitor. Because I've decided what my activities are going to be, I should also start thinking about, if let's say I do these activities at the end of 1 year, how should I monitor whether these activities were done. So if I'm giving a training right now, my monitoring can be done that whether or not training was done A, B, how many people attended the training, because my aim was training 60 people. But I realized through my indicator that I was only able to train 50 people. So I'm still not achieving my so-called goal. So that sort of aspect helps if I decide early on that this is my activity and this is how I'm going to monitor. Evaluation plan, generally while the evaluators decide, it's important for the program to think about evaluation, that whether or not it will be needed, what would be the goal of evaluation. Because you are a program implementer, you are the best person to understand that this is what I want to evaluate. Certain things like we just discussed in the previous session, like an output, is something that you can cover in your monitoring. So you don't need to go in depth on your evaluation covering those outputs. But outcomes, being the long-term factors and requiring certain more efforts, would need a specific person or an evaluator to come and assess that. So at the beginning, we can think about those aspects when we are developing our program, about the M&E plan, that this is going to be my larger M&E framework. We'll also be getting into more detail of the results framework tomorrow in the session, of how exactly should I go about my monitoring indicators, my evaluation indicators, and what should be the important facets when I start drawing those results framework that I need to consider. But just keep in mind that we need to have, it's good to have a monitoring and evaluation plan at the beginning, so that I already know what am I going to assess. So when we focus on monitoring evaluation, there are certain aspects that we think can help in policy making or government programs. We start with one, being accountable. My monitoring exercises, my evaluation exercises can help me understand that whether or not, specifically I put financially here, it can help me understand that whether I was able to achieve my activities within the set budget that I had, or if I overshot the budget, or if I was not able to do certain things because I did not have the budget. So that accountability element itself can help me understand whether my program is, my policies, my government programs are running as I intended. That is one function that a monitoring and evaluation can help you answer, whether financially I was accountable to the program plan that I started with. Another aspect is improving operations. Something that a monitoring does is, during the program is implementing, it helps you understand how the program is being implemented. So I can improve my operations. If 1 year, I know 1 year down the line that I started implementing my training programs, let's say I'm running a program, we were evaluating program that was focused on improving institutional deliveries. So couple of activities that they were doing here was, they were training the nurses, and they were also improving accessibility to the facilities. They were also improving knowledge within the women to come to facilities for a delivery or a childbirth. Now, my evaluation at the end of midline told me that the knowledge that you're trying to give to your nurses is not getting translated into practice. Why? Because multiple factors, one of which could be that my nurses are not confident enough to actually practice what has been told because there are no doctors standing beside them. Or B, it could be that in the training it was very, learning thing, but when the time comes, because childbirth is such an important process that's happening, at that time they're not able to really recall everything that they were taught, so they don't end up doing those practices. So there was a knowledge doing gap that existed, a no-do gap that we found as my, during that. So what my evaluation helped me assess is that this is the issue. So next time when the implementation happened, I started giving more trainings so that they can practice what they were being taught. So I also added an element of a mentoring stage, that a doctor will now help you in live childbirth and you will practice what you've done. So I helped improve my operations while the program was ongoing. Something of sort of a course correction. Readjusting strategy, it's similar to this. It can also happen in terms of budgeting financially or in implementation. That my this was an evaluation example that I just gave. For monitoring, what can happen is that let's say we are implementing a program where we are training the Anganwadi workers and they have to start operating a portion tracker app that has been introduced by the government to report for everything that they're doing. Now, I gave them a very initial training and I gave them devices, and now I realize that eventually what is happening is most of the devices are not working, or the app is so dysfunctional that it only opens at night. They can't be working at night. So I need to readjust my strategy. I need to work more on my app better. I also need to give them better or functional devices so that they can start practicing what they have been taught. So again, I readjust my strategy that certain tweaks can happen and it might help me achieve my results in a more better manner. Strengthening the capacity. Here we are also looking at strengthening the capacities of institutions as well as individuals, and it can be of an implementing organization as well. So let's say, like in this example, we had an Anganwadi worker working on a Poshan Tracker app. Oftentimes, one of the studies that we did in Uttar Pradesh, what happened was a lot of the Anganwadi workers were very old and not digitally literate. So they were not familiar with how an app would work. So what I realized was that the individual capacity is missing to operate what I have given to them. Or it can also be that the trainers who were coming from the government to train the Anganwadis were not as skilled or were not able to give that training. So I can strengthen my individuals as well as my institutional aspects to help improve my government function, my program functioning, my policy functioning. Another aspect is understanding and documenting the context. So something that Professor Sivakumar was also talking in the morning, that how contexts differ very much and they play a very important role in what a program is going to be like. How the beneficiaries will respond to your program will depend upon the context. Something that I think is okay to talk in a Madhya Pradesh context might not be okay to talk in a Sikkim context. This is because of the local population, their beliefs, their traditions, their setup. So what an evaluation or a monitoring study or a research study can help me figure out is what is the context in which I am operating, in which I am going to implement. So my program, my strategies need to be according to the context. If I start doing something that's very opposite to what people expect, to what people think like, it's going to immediately fail. To even bring a behavior change, we can't immediately start saying that, no, you just stop this and you start doing that. So that slowly, it's going to, through different strategies, it's going to come about. What happened in Swachh Bharat mission often was that you built toilets, but people were not using because they were not behavioral to using toilets. They felt very restricted. In a lot of states, it came out in a study that they felt restricted going to a toilet. Or they did not feel like they were very used to an open setup. Their traditional beliefs were that you gave us money to build a toilet, but our toilets are never, because it's a space that they consider dirty, they don't think it should be in the home. So they are still not going to use it if it's constructed in the home. So part 2 or the phase 2 of Swachh Bharat mission actually focused more on bringing in behavior change. So let's start making people more aware. There were different strategies. There was also the whistle thing that they started implementing. They formed groups of volunteers of Swachh Bharat mission who, when they saw people defecating in the open, they would start whistling. So that's a shaming technique that works or not is up to people. But that might work in some setups and it might not in some setups, right? So that is where context plays in. It might happen that these volunteers might just get beaten up in some context if they start whistling in the morning. It's somebody defecating in the open, right? That's very important that research helps us reach that. That I understood how I should go about my implementation and even how I should carry my evaluation. Because I, as an external evaluator, if I come and start directly questioning populations in a way that they don't think like, they might just run me out of the village. They won't answer and I won't be able to tell you that this is what's wrong with the program because I did not understand the context and just went ahead. Context is very important and lately that's been a very important conversation piece in research evaluations across the world. Next is deepening understanding. So what a particular research, monitoring, evaluation in a policy space or a government program space helps also is develop a greater understanding of the issue. So if I had a program that was doing very well in a certain setup, I could take these learnings and I can work further on it in a different setup. That sometimes in the terminologies that we use often is something called a scalability or a replicability. So what happens in a program if it's going well, there are often two thoughts that I can replicate this program in other setups or I can just scale it. I started a program with 6 districts and I scale it into another 6. So scalability is I going into a larger scale, and replicability I doing it exactly in the same aspect. So once I developing a deeper understanding helps me on these facets, that my understanding of a particular issue also develops more. I was not aware of certain family planning issues till I started doing my research, my evaluation of a certain program. And then I understood that there's a huge issue that young women often discontinue a certain form of contraceptions because there are certain factors associated. So my evaluation of a program helped me develop a deeper understanding, and I'm contributing to the next set of program or the next set of policies which will be on the same space. Building and sustaining trust. Something that a monitoring and evaluation or the research gives is provides you the results, right? We saw that it can happen during the program implementation or it can happen after the program implementation. So what we have, that level of accountability, that level of transparency. Once those program results are shared, let's say a senior person shares it with you on your activity, you know where you're going wrong or you know where you have achieved better. So that helps build a trust, a shared trust on whether or not how a functioning should happen. And it can also be with the beneficiaries or the populations. So if my population or if my beneficiaries have access to information that this is how my program runs, this is what my program achieved, it can help build them trust. So it can help enhance the trust they have in the government programs and schemes. Advocacy, using the results of various activities that we do to help advocate, to help improve, and to help for greater change. Advocacy happens at different levels through different mediums. A lot of civil society, non-governmental organizations, they use the results of different reports to advocate for a better outcome or to advocate for a different strategy, so on and so forth. Sensitizing for action is that when we are able to showcase the change, when we are able to create a shared trust and accountability within the beneficiaries, they might be sensitized for an action. If I start telling people that, I have built a toilet and my results or my reports or my research has shown that there are 15 benefits of having a toilet in your home, there are greater chances that if I do other activities, people might start using toilet. Because I have to educate them further on what are the benefits. And something like a evaluation, something like a research can help me provide that evidence of how it can be better, and educating or spreading awareness. Because I can't just go in the dark spreading awareness about anything and everything. So I need focused aspects on what I need to specifically target. So for instance, we are doing a project in a couple of states which is focused on respectful maternity care. And one of the first elements that they're trying to focus on a social behavior change aspect, that they want to bring a behavior change in the people, in the providers, in the hospitals or in the communities, that women need to be treated respectfully when they go to a hospital for childbirth. Now, one aspect that I am doing here is that they are going to be training the health providers, but they're also going to be spreading awareness within the people. And my research is going to tell them that people already know ABC, now you should focus on D, E and F aspect. You should tell them that this government or this community mechanism exists because they're not aware that exists. So even if they get treated badly, they don't know where to complain. So this helps me focus my attention on where I should be getting more action on, and where people can help me be sensitized better for action. So these were larger purposes that an M&E or a monitoring evaluation can serve in a policy or a government space. Now, we can also break it down specifically by monitoring, evaluation, learning. When we talk about policy making, something a monitoring can help us identify is what are the problems and challenges in the beginning stage, or while I'm formulating my certain aspects, or while I'm implementing. Because monitoring happens while the implementation is happening, it will help me identify the problem while the implementation happens. So during a monitoring that happens during helps me identify right then and there that these can be some course correction, or some of your strategies are just not working, you need to stop them or change them. Evaluation, in essence, since oftentimes, let's take an example of an end-line evaluation, because I'm doing it after the project has been implemented, it can help me understand that what were the factors that led to the success of the project or the failure of the project. Or half of it was successful because some strategies worked really well, but some didn't. So it will help me, evaluation will help me understand what are those factors that contributed to success. And thereafter, it can, like you said, somebody was talking in the previous session that a second phase has to be implemented. So the evaluation, end-line evaluation from my first phase can help me tell what should I be doing right in phase 2. Because certain strategies in phase 1 never worked for me. So I should not put more money in phase 2 in the same things again and again. Because my evaluation was able to help me with that sort of aspect. Also, provide recommendation. So even if a second phase is not happening, the recommendation for future work can always be given. That I did so and so thing, I did a program implementation, and these were the success factors for me. So if somebody else is doing similar, they can just learn from what my experience was. And eventually, learning is about also dissemination of knowledge or sharing of knowledge. So if I share these knowledge from monitoring evaluation activities, such as best practices, we often in our documentation, be it a Niti Aayog or a lot of government institutions share best practices that have worked across the countries. Often innovative practices are often awarded as well. So learning element will help me share those best practices that can help inform my future strategies for policies, as well as develop a collective understanding. Because like we just discussed, the policies are at a larger level. So at a greater level of understanding, at a national level, I can see what are the aspects of a different policy. And if somebody sitting in Africa wanted to do something similar, they would have a learning experience shared by me. Obviously, context would matter because they would have to adapt it to their context. In terms of government programs, so something like different phases when we have in a monitoring and evaluation, we start with a needs assessment. A needs assessment will help me identify the needs, right, as the name suggests obviously, and the priorities of what my target population wants. Because I want to implement my project in 6 districts here, and I need to know what are the target needs of my population in this sector. At the same time, what is the current situation? How should I tackle that situation? So what are the gaps? While everybody is going to school, there are certain populations that are not. So what is the gap there? And develop an evidence base. So I have an evidence of how my program should be designed. When we get to the next phase of program designing, my evaluation or my evaluation, like a baseline, let's say, evaluation, can help me understand that what was the context in which I'm going to implement my program. What was my target population like? So if I have a family planning program that is targeted towards young couples, so I need to understand that what is the demographics of the young couples, what age people are generally getting married. If my understanding of a young couple is, let's say, a 24-year-old, but it might not work in a certain setup, and they say that, it's 17 onwards that people start using contraceptions. So I need to shift my focus to those areas. So a baseline or a needs evaluation done before a program design can help me designing and strategizing better. Also, what are the available resources? So how best to utilize my resources? I have $20 million. I need to design my program that I am able to because I am doing activities that can be done within $20 million. I can't say I'll start building big institutions when they're not going to be able to be done in this much amount of money. So my program design needs to be very aware of what are the resources that I have, and something at the beginning can help me understand that. During implementation, we have often the monitoring exercises or something like a process evaluation that Kezia was discussing, that we can set up monitoring systems. Monitoring is both an largely an internal exercise, but also an external exercise. So monitoring systems can also be developed by a program implementer, by somebody like you who's working in implementation, or in collaboratively with me, like an evaluator. Oftentimes, monitoring systems, when we are setting up, they're in form of dashboards, like we have for a Swachh Bharat mission. We have this huge dashboard which shows so many people, so many villages are open defecation free, so many households have toilets. So all of that is an ongoing data that you keep changing and keep reflecting. It is happening because on-ground monitoring is telling me that, I'm assuming. That somebody in the ground is giving me that information to my district, to my states, which eventually goes into the national dashboard that in so many states, so many villages are now open defecation free. So something like a monitoring system is a dashboard that can be tracking, or a tracking tool that often tracks. And most important aspect in often monitoring systems and these dashboards is how well capable and how well is your on-ground force, your frontline workers, your ground implementers. Unless and until their capabilities and their capacities or their resources or infrastructure is built up, your monitoring might not be as effective. Because you can't go every day to the ground to start collecting data. It's the people who are there who are going to give you that data. So those capacities need to be built for an effective monitoring system. Tracking the program progress, because we are doing it regularly, let's say a 6 monthly, I am regularly tracking my program is reaching from a 10% to 20 to 30. So when my evaluation said that I have reached 40% change, my monitoring would also be able to support that. Or maybe negate that. They can say that my monitoring shows there's 50% of change, so you need to relook at how your evaluation was done. Identify the challenges, because we are regularly monitoring. So if an indicator, I constantly see that I am putting in all my resources, but one indicator is not moving. So what I can do is I can start doing let's say a case study. I can start figuring out why that only one indicator is not moving as it should be, why that aspect of change is not happening. So I can track it, and at the same time, I can redesign, I can make tweaks to my strategies, bring in a course correction measure. Evaluation is eventually because it evaluates the effectiveness of your program and the impact, because we just studied the levels of results and the hierarchy of results. So my impact and the change that has come over time is what my evaluation is going to help me out. So whether what I wanted the change, whether that was achieved because I envisioned a certain number of outcomes, whether those were achieved or not, whether there are still areas for improvement, because my evaluation has told me that I have achieved so and so, but there's still certain aspects which are missing. And lastly, if I want to go ahead for a next phase, or if I want to scale it up, how should I adjust my program design? Learning eventually is improving my program implementation from all of this experience. So everything that has been done till now, from needs assessment, program design, everything feeds into learning so that I can improve my constant strategies and my program designing. So what we just did was how monitoring, evaluation, learning, different aspects, we were breaking it down for a government program. And let's try to build an example on how a MEL can help me in a sanitation program if I am starting with a sanitation program. So during design, what would any of you recommend? What can be how can my monitoring evaluation help me during the design phase? In my program, what can my evaluation, if I did a baseline or if I did a certain kind of needs assessment, how can it help? If I have to develop any kind of, if you're not familiar with the sanitation program or something that you are supposed to be doing, how would a needs assessment or a baseline help you out? What will it help you in? Let's see. So let's say I conducted a baseline or needs assessment, right? I did a survey because I'm going to do a sanitation program, I need to do a survey. Let's say my activity that I'm thinking of doing is building toilets and spreading awareness in people. So my first survey that needs to be done is needing to understand how many households have toilets. If everybody has toilets, why am I going ahead and building double for them? Nobody's going to use those. Similarly, if everybody is already aware and not practicing open defecation, I don't need to go teach them again. That is just a burden of just going and they're not going to listen to me. So in a design phase, I can do a survey and I can figure out at the baseline how many households have toilets, what is the knowledge or awareness level of people regarding open defecation, whether they know that use of a toilet is helpful in not just sanitation but also health outcomes, because there are certain infections that can spread. So if I'm using a toilet, that might not happen. So at the design phase, conducting any kinds of needs assessment, any kind of baseline can help me figure out what should my strategies be. Whether I need to go ahead with this strategy or should I think of something else. Similarly, when I have an implementation phase, now that I've started implementing my program, I am doing, let's say because it's a sanitation program, I'm building toilets. At the same time, I'm also spreading awareness in people. If I do an evaluation or a monitoring during implementation, it will help me figure out whether or not, first of all, I have a dashboard, whether or not I am building as many toilets as I've spent the money. So I am saying I've spent because my funder, let's say, or a state government has given you 20 crores and 20,000 toilets were supposed to be built in that, let's assume. But my monitoring after a year is telling me that all the 20 crores is spent and I've only built 5,000 toilets. So during implementation, my monitoring, I conducted a survey or my monitoring exercise itself, because on ground, my people are telling me that so many toilets have been constructed in this village. So if I know now that this much money has been spent, but the result is not what I have planned or what I have said it would be, I need to take a look at where did my money go. I need to take a look at why this much money was sufficient. Maybe I thought that one toilet was 10,000, but it's taking me 15. So that's why I have less number of construction happening. So that sort of aspect during the implementation can help me track whether I'm going on track, whether I am spending as I'm supposed to be, whether I'm achieving what I'm supposed to be, and if I'm just totally not wrong in the wrong direction. In an evaluation phase that we have now implemented a program and now we are evaluating the effect. So my effect should be that I have built the toilets, I've also built awareness, now people should also be using it. If I still go and find people are still not using it, then definitely there was something wrong with my strategies. I need to re-strategize. Or it can be that 85% people have started using toilets because of my intervention. So I did a survey at the baseline that 50% households had toilets. During my end-line evaluation, I can go and I see now instead of 50, 95% households have toilets. So this is because I was constructing, and I have the record of monitoring as well, that I constructed so many toilets. So that can directly tell me that it's because of my efforts that so many households now have toilet. Tracking behavior change, while something like a construction infrastructure would be easier to track and attribute to my project. Because I know I spent that money and that toilet shows that it's built by so and so government program. So I can very clearly say that this is because of my program. But a behavior change is something that's difficult. It's possible that while your program was spreading awareness, there was another civil society organization that was also working on the same issue. So then I can't say with 100% confidence that only my program brought that change. So there, different types of evaluation can help me figure out whether it was directly because of my program or my program could have been one factor. Because multiple things happen. Oftentimes it happens for things like stunting and these aspects that direct causality is difficult to establish. That just because I spread awareness, people started doing everything, it's not possible. There are multiple factors. At the same time, somebody was also giving them money to have kitchen gardens. So their eating habits improved, their dietary diversity improved. So now the children are not as stunted because the nutritional status improved. So there are multiple aspects that could have happened. So my evaluation can help me figure out whether it was my project directly, or I was a part of the change that was brought, or I was not a contributor at all. So there'll be obviously a different kind that will help me, but evaluations can help me figure that out. And lastly, my learning, like we've just been discussing, that my certain innovations that I brought, like the shaming thing, that example that was used, that worked out in certain contexts. So it was often cited as a best practice also, that they made a group of volunteers who would get up in the morning and go. So that was often an innovative, adaptive practices that people were citing. And it is because of certain research that happened that we got to know that these activities worked for certain groups of people. So I can go ahead and try depending on how I feel it is relevant or not. So that best practice sharing, that knowledge sharing, if that happens, only then the result of your evaluation can become more effective. It can be that I did an evaluation, I only reported to a state level or national level, it never got back down to you. So eventually implementation might not change because it's only at a certain knowledge sharing is not happening as it should be widely. Now, as we are moving in the discourse for development sector also, there's a greater emphasis now that we are saying that the results and information need to be shared with the community as well. So because you are working for the community, you should start sharing and discussing your results with the community so that you can improve and they can also hold it accountable. So a lot of our funders and our multilaterals and bilaterals that are giving, they're also pushing for that they're asking us that, you've done an evaluation, how are you going to share your results with the community? So that aspect again will be a part of learning, that I'm building those platforms for sharing my learning. So there are just certain examples that I have prepared and certain strategies on how we can do it. So let's say we have an aspect of strategy and direction. So are we doing the right thing or are we going the right way? So an M&E question that, or a research question can be that how was my program theory developed? Or how has it changed? Because my monitoring helped change it, right? So whether the program theory existed in the first place. So your logic model that Kezia showed in the first session is something, if that did not exist, it could be that you were just making plans in the air because it was my knowledge. I said so I did it. But that's not how the policies or government programs would work, right? You have a theory of how a change is supposed to happen. If I invest so much money into these many activities, then I will achieve this output, which can lead to a certain outcome, which would eventually lead to an impact. So that is essentially the program theory. So whether or not a program theory was developed, whether it changed over the course of time, whether even it was appropriate to my program, is something that a question can be asked. My research can ask that question. Or are the right stakeholders being engaged? It can be that I'm implementing a program for school dropouts, but I keep talking to the sarpanch of the village. I don't even go to the parents. So I'm not working with the right stakeholders. So my stakeholders need to be identified in the beginning. We'll just be focusing on doing a brief exercise on stakeholder mapping as well, but that's a very essential stage. That am I working with the right stakeholders? Have I recognized everybody who would be within the sphere of change, or who could make an impact, or who can be an important player? Or it can be the opposite of what example I just gave, that I am only talking to the parents, but it's actually the head of the village who's telling people that you should not be sending your children to this school. So I need to engage both. And also, are my research questions overall in line with the priorities or strategy? So if my policy is prioritized towards something else and my program is working on something else, so my research questions need to figure out where am I If I'm doing an evaluation for a program, I need to be aligned to what my program strategies are. And if I'm doing an evaluation of a policy, I need to be aligned to what my policy strategies are. How can I do it? Some ways is, for instance, if I am looking at whether my program theory changed, I can review my reports, right? Because every programs and all of them, they often come out with annual reports, quarterly reports, there are meeting plans that are often shared. So if I start tracking and reviewing those documentation, I am building an evidence base of whether I was documenting or certain things existed or not. So if, let's say, for example, I introduced a health information system. For a health information system to be introduced and used, I will also start giving GOs. I will send government orders that certain people need to use the HMIS, or certain trainings were held to use the HMIS. So once I have reviewed and documented that these government orders clearly show that people were given training, that's an evidence that I have built. So that's a very simpler or a comparatively easier way that I can start also building an evidence base. I can review the documentation. Or once talking about the right stakeholders being engaged, I can conduct workshops or meetings with the key partners and stakeholders that I envision, right? If I selected 5 groups of people as stakeholders, I hold a workshop with them and I realize that one of the groups is not at all relevant. They're not responding, or they're not interested in the matter, or they're not working on this at all. So that workshop could help me figure out whether right stakeholders were engaged. And lastly, one example again is a stakeholder analysis or a social network analysis. Those are different techniques which help me analyze whether the stakeholders that are engaged are the right stakeholders, what level of interest, what role do they play, and whether they are participating in what manner. So that sort of analysis can help me figure out my stakeholders and also my implementation or the direction that am I doing the right way. Something of a management function that a M&E would serve is, are we implementing the plan as effectively as we think it can be? So there are certain questions, that is, if I had a certain set of indicators, to what extent did I implement them? So let's say I was supposed to achieve certain goals within 3 years. So my question should be whether I achieved them in 3 years or not. If I am only able to achieve half of them, then that gives me an idea of whether I was out of line, or whether I was overthinking, or whether I was under budgeting things. So that question needs to be there of to what extent, within what timeline did I achieve my deliverables. Budget, was the budget spent as I needed? So that's a good research question that can be. And if the decisions are made in a government setup, often we have meetings, they're all well documented. Then government orders are sent that so and so decision was taken and it has to be implemented in so and so manner. So that question, that whether these decisions were taken, how were they implemented, were they documented or not, is a question that will help me address decision-making questions or governance aspects if it comes. Certain exercises that can happen is again a review of these documents, a monitoring review, because if I'm holding trainings and I'm constantly monitoring that this month 10 trainings happened, next month 15 trainings happened, so I am constantly monitoring and I'm saying that, you know, my budget is spending in so and so, so I'm spending as I planned in so much amount and I'm going the right way. So am I implementing the plan as effectively as I can because I'm doing the best that I can? Or the capacities of the organizations or the people, like we just said, like the example of an Anganwadi worker. If I didn't assess, if my evaluation did not help me figure out that my Anganwadi workers are not digitally literate, they don't know how to operate a mobile, I might keep putting in more money. I might never realize that, you know, I've put in so much money, but they're still not using it. So those aspects or certain kinds of ways can help me assess whether I'm reaching those questions and answering those questions or not.